people who died specifically in August last year, 1 month after the Delta variant became the predominant variant in the US then. And now that the Omicron is fast spreading, she says she's even more worried for the unvaccinated and pregnant. But what is the current status in Nigeria? Joining us in the studio here in Lagos is Dr. Gregory Ohihoy. He's an obstetrician, gynecologist, and a chief research fellow with the Nigerian Institute of Medical Research, NIMR. Thank you for joining us on the program.
My pleasure, Millicent.
All right. So, yes, the National Primary Healthcare Development Agency said pregnant women, lactating mothers can take the vaccine, the COVID-19 vaccine. Is that still taking place?
Yes, and then that's the recommendation worldwide. You know, the CDC in Atlanta, that's the US CDC, has very clear recommendations on the use of COVID-19 vaccine in pregnancy. You know, like the data you are actually quoted noted that, you know, the mortality from COVID-19 for pregnant women was quite disturbing, particularly in the early stages of the pandemic. And with the vaccine now known to be safe, at least from the current available data, it makes sense that our pregnant women should have this vaccine. They should be encouraged to have the vaccine, irrespective of the stage of the pregnancy, first trimester, second trimester, third trimester, puerperium, when they are breastfeeding. You know, it's safe for them to have this vaccine.
Well, the question now is, are pregnant women in Nigeria really taking the vaccine? Is there any data to show the number that have received?
I think the real problem is that the communication, the messaging is not correct. I think we have to target pregnant women and let them know that it's safe for them to take this vaccine. We should incorporate this into our antenatal care program in many of our public settings. It should be a part of the antenatal care program. We should come out with practical strategic programs to encourage the pregnant women to take the vaccine. Just like we encourage them to take their tetanus tozoid immunization during pregnancy, we should make it a part of the health talk we give to them. You see, the challenge I have is that if you don't come up with a strategic program to solve a problem, you won't get the answers that you desire. We can't wish it and hope that the pregnant women will just take the vaccine. But if we encourage them, we incorporate it into our current antenatal structure, particularly in public hospital settings. We develop jingles, you know, deliberate public health effort to raise the awareness, we'll be able to raise, you know, vaccination rate among pregnant women.
We'll come back to some of the beliefs and perhaps myths concerning vaccinating pregnant women. But pregnancy, is it one of the underlying medical conditions that makes COVID-19 more susceptible to attacking them?
Not necessarily. I mean, the evidence we have so far doesn't show that pregnant women are more susceptible to COVID-19, you know, like as per a special group that is more susceptible, no. And we know that generally with pregnancy, there's relative drop in the immunity level. And anything that can drop your immunity level will make COVID-19 more aggressive. Remember that you're also dealing with two situations. You are also increasing the risk of the unborn child of having COVID-19. And the evidence is not so clear whether there's transplacental transmission of COVID-19 to the baby. You know, it's still out there in the jury. And some data says there's transplacental transmission, so data doesn't support it. But what we know, which is more important, is that the vaccines are safe and they are effective. And we should encourage the pregnant women to take the vaccine.
So how much of that do people really know? Because there are fears about essentially it being associated with preterm delivery, underweight in the newborn. I mean, is there any study that shows that these vaccines are actually safe? And also, the back end is those who are, you know, rendering these services, antenatal care, are they really sending the message? Or, because I know some health workers who actually don't believe in the vaccines to start with.
Exactly, Abi. I think the last point you made really describes the situation we have. You know, people have to, the health workers themselves have to have that conviction before they can even convince the pregnant women. There's enough data. You know, like I was just reflecting before I came to the studio. COVID-19 is no longer new to us, relatively. This is the fourth year, Millicent, it's the fourth year. It's 2019, 2020,
December
2021, 2022. So it is the fourth year we are dealing with COVID-19. There's some things we now know. I mean, we could have feigned ignorance, you know, in the beginning and say we don't know many things. We now know there's enough data available in literature, available for those who are interested to show that, you know, the vaccine is safe in pregnancy and people should be encouraged to take it. Of course, there will be myths. We are not aware from the current data that it decreases the risk of preterm delivery. is not associated with any known congenital complication. Congenital, I mean complications or birth defects that you have when people have their babies. Well, there's no data to show that as of this moment. But we know that it can cause deleterious, negative effects on mother and baby. We know that. So let's work with what we know. We know that the vaccines are safe. We know that COVID-19 can run a very aggressive course among pregnant women in some cases. And we know that there's a vaccine that can reduce the risk of severe infection. Note that it's not as if the vaccine will prevent them from having, COVID-19 infection, but we know that at least it will prevent the risk of having severe infection and mortality in these women.
My final question is, very briefly, the Omicron variant, does it bring any added risk to the mix?
No. I mean, for what we know from the Omicron variant so far, the data we have shows that it's not as aggressive as the Delta variant, which is good. But remember also that the Omicron variant spreads very rapidly. So what we may have gained from the lack of aggressiveness of the Omicron variant, we may also lose in the sheer number of people who will get infected. Because if you have so many people getting infected, you are going to have so many people needing admission. You're going to have so many people that will overwhelm the health system, going to distract health workers from focusing on other aspects of healthcare. So I really think that really Omicron is not so special in terms of severity, but special in terms of its ability to transmit to people at a very rapid rate.
We appreciate your time. Thank you, and your knowledge on this issue. Thank you so much, Dr. Gregory Ohinhon. He's an obstetrician, gynecologist, and chief research fellow with NIMA. Thank you for joining us.
You're welcome. My pleasure.
Well, we have more stories around the world about the coronavirus pandemic. Please stay with us. Welcome back. French President Emmanuel Macron has warned that he intends to make life difficult for people in France who have not been vaccinated against COVID-19. He told the Le Parisien newspaper that he really wants to hassle them and will continue to do this till the end. His comments come as a bill on COVID passes was delayed by opposition MPs uniting against the government. A debate in Parliament on the bill, which would bar the unvaccinated from much of public life, was prevented from continuing after midnight. The legislation is expected to be approved in a vote this week, but it has angered vaccine opponents. Meanwhile, in a matter of weeks, the COVID Omicron variant that was first detected in November surged around the world. Now, there are early tentative signs that the Omicron wave has peaked or is plateauing in the places that were among the first to be hit hard by the strain. We'll go over to South Africa. Professor Jerry Mfalele is Vice President for Research at the South African Medical Research Council. He joins us now for more on what's happening there. Thank you for joining us on the program.
Thanks for having me. Just a small correction. I'm the Deputy Vice Chancellor for Research and Innovation at Northwest University.
Well noted. Thanks again.
Thank you.
Thank you. Tell us, has South Africa passed the peak of the fourth wave?
Well, in all likelihood, it looks like we are coming out of, the fourth wave. So there was no magic, really, because there was no strict lockdowns. I think it's very much about the dynamics of Omicron. As a variant, it looks like for us as in South Africa, the variant was very mild, if I can put it that way. I like to believe that a lot of people were exposed to the variant, even those who were not tested or those who did not show up in hospitals. But because it's mild, obviously there were a lot of asymptomatic infections. And, for those who were testing, we have seen the numbers, they have rise and immediately, dropped. So it was not like, the other waves that we have seen where we had a protracted wave. So this is actually the difference between the current wave and the previous one.
But if we're looking at the waves also, one begins to wonder, and this is, with what is unique to South Africa, in this case, the fourth wave peaking, the US and Europe appear to be struggling. They're rolling out booster shots as fast as they can, but we're seeing loads of cases there.
Yes, I think, if you look at COVID-19, although we have got 2 years of experience with the virus, it looks like a lot is still unknown. So I'm saying this because I really don't understand, maybe the difference between the countries in the north and maybe South Africa. Although one can say that perhaps something that is unique in the Northern Hemisphere is going through their winter season, and perhaps that could be another factor that we need to take into account. So all over the world, it looks like the Omicron variant. It is mild, and because it's highly transmissible, the sheer numbers of people who get infected, obviously, and who might need medical care becomes huge. And I think this is where the health facilities become inundated with hospital admissions. But we know at this stage that the hospital admissions do not necessarily mean that most of the patients are on oxygen, for example, or they are in ICU. These are just symptomatic patients, and they just need, most of them require just normal care.
Prof, in a recent statement, the State Department of Health, South Africa, said cases were declining in almost all the provinces except the Western Cape and Eastern Cape, which recorded increases, rather, 14% and 18% respectively. Why uniquely to those areas?
It's been a trend with other waves as well. So we know that not all areas or provinces will come out of the wave, at the same time. So the different areas in the country, they come out of the wave at different time points. So the wave started in Gauteng province, which is like, the economic hub of the country. But we have since then to other areas. And as you rightly said, there are still other provinces that are experiencing high numbers of cases, particularly the Western Cape and also KwaZulu-Natal. These are mainly the coastal areas. So it looks like, the cases have moved towards, the coastal areas. And it could be that, for South Africa, this time of the year, they move from the inland to the coastal areas as part of the holiday season. So that could actually, be one reason why the numbers are still high in the coastal areas.
If I might ask, I mean, this is, the fourth wave South Africa is coming out of, and one would say with South Africa and other countries around the world, Omicron is driving the surge in infections. But what is happening with the Delta variant, do you think?
Yeah, very interesting because the Delta variant is completely replaced by the Omicron. The first report of Omicron in South Africa was somewhere on the 22nd of November. And by the end of November, 75% of the sequences that were monitored by the sequencing network, they were Omicron sequences. And by mid-December, almost 100% of the sequences were Omicron. So it just shows that the variant is highly transmissible in a setting like South Africa. And obviously we have seen now with other countries. And is most likely to replace Delta in many other countries. I have no doubt about that.
Deputy Director, Research Innovation, Professor Geoffrey Mfalele, many thanks for joining us today.
Welcome.
The Omicron variant is driving record daily cases of coronavirus from the US to Australia, adding pressure on health systems. Now, daily coronavirus infections in the Netherlands have soared to a record high. Officials confirm that Omicron has become dominant in the country, while Israel's health ministry has also announced nearly 12,000 new coronavirus cases, the largest daily rise in infections since the beginning of the pandemic nearly 2 years ago. Here's more of the global update.
Israel has changed its COVID-19 quarantine and testing policy in what the health ministry described as an effort to ensure continued protection for vulnerable populations from a surge in infections fueled by the Omicron variant. PCR tests will be earmarked for people aged 60 and over with weak immune systems, while those at lower risk will be checked with rapid antigen tests. The country has confirmed around 1.4 million infections since the start of the pandemic and more than 8,000 deaths. About 60% of its 9.4 million population are fully vaccinated. The United States has reported nearly 1 million new coronavirus infections, the highest daily tally on any country in the world, and nearly double the previous U.S. peak set a week ago. The number of hospitalized COVID-19 patients has risen nearly 50% in the past week and now exceeds 100,000, marking the first time that threshold has been reached in a year. Australia's daily COVID-19 cases has hit a record high for the third consecutive day, further straining hospital resources and testing facilities as public anger grew over the handling of a fast-moving Omicron outbreak. New COVID-19 cases in India surged to 58,097 over the past 24 hours, a doubling of the daily tally over the past 4 days. Health experts have called for preparations to ensure hospitals are not overwhelmed by a new wave of patients. Hong Kong leader Carrie Lam has announced that the government will introduce a series of new measures to curb the spread of COVID-19. The new rules include a ban on flights from 8 countries for 2 weeks from January 8th, affecting Britain, the United States, Canada, Australia, Pakistan, Philippines, France, and India. Singapore's COVID-19 task force says it expects the Omicron coronavirus variant to cause a bigger wave of infections than Delta and urges the country to prepare.
Yesterday alone, we reported 438 Omicron cases. Hence, it is very likely that we will see an Omicron wave quite soon, with local and international evidence indicating that Omicron is more infectious compared to Delta. We must be mentally prepared that the Omicron wave may be greater than the Delta wave we had experienced before.
Over in Europe, British opposition Labour leader Keir Starmer has tested positive for COVID-19. He had been due to face Prime Minister Boris Johnson at a question and answer session in Parliament later today. Starmer previously tested positive for COVID-19 in October. Poland's President Andrzej Duda has tested positive for COVID-19. He had previously tested positive for COVID-19 in October 2020. The president's aide says he's been vaccinated 3 times against COVID-19 and is in isolation with no serious symptoms.
We have more updates on our website, channelstv.com. You can find also a better understanding of the pandemic, plus other stories, breaking news. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.
Be patient. Everything in life will go exactly how it's supposed to go. At times you will feel like an outcast, that you don't fit in, but you will discover that being your own clique will be your strongest attribute. In life, you're going to face many challenges, many moments of adversity. There are going to be a lot of successes and some failures too. Those moments are going to create your character, build your integrity, and they will become your beauty marks.